Hi, my name is Daniela Darcangelo,
And my name is Kaitlyn Gonzalez.
and today we're going to be talking about cholera.
So, to start, we're going to answer the most basic question. What is cholera? Well, the most basic answer is that cholera is a disease caused by bacteria that results in severe diarrhea and dehydration. Cholera has been called the disease of the 19th century and the pandemic of the Industrial Revolution.
Now, how does one get cholera? Cholera is contracted through consumption, but not only the consumption of food, but also the consumption of food and water. The food or water needs to be contaminated with the bacteria Vibrio cholera 01 or 0139. This bacteria is spread in food and water commonly comes from contaminated water with the feces of an infected person.
Vibrio cholerae is a bacterium belonging to the family Vibriochnaceae. It is a comma-shaped or curved-looking gram-negative bacteria. As all bacteria, Vibrio cholerae is a prokaryotic organism. Prokaryotes do not have a nucleus like eukaryotes do. The term gram-negative refers to a staining characteristic of the bacteria. So, the bacteria will have a specific cell wall structure that appears pink or reddish when stained. Gram-negative bacteria causes amongst the most significant public health problems due to their high resistance to many different antibiotics. So Vibrio cholerae is typically found in aquatic environments, and it has the ability to survive and multiply in water sources. Vibrio cholerae does not require a host for its survival, but it does require a human host to cause the disease cholera. Once ingested, the bacterium goes straight to the small intestine and produces a toxin called the cholera toxin. This toxin causes the characteristic symptoms of cholera.
Contamination also depends on quantity, as vast amounts of vibrios must be ingested for someone to get sick. After passing through the stomach, the vibrio multiply in the small intestine and secrete a toxin, which provokes a series of biochemical reactions.
Because cholera is spread through contaminated food and, more importantly, contaminated water, cholera is common in developing countries. For example, in 2019, Yemen accounted for 93% of all cholera cases. Right now, 30 countries around the world are combating cholera outbreaks, with Africa accounting for 26,000 cases. Around the world, researchers have estimated that each year there are 1.3 to 4.0 billion cases of cholera, and 21,000 to 143,000 deaths worldwide due to cholera.
The cholera virus attacks the digestive system, and the bacteria specifically colonizes in the small intestine.
If a person contracts cholera, their symptoms will usually occur 2 to 3 days after they ingest the contaminated food or water. The symptoms that indicate a patient has contracted cholera include diarrhea, vomiting, dehydration, leg cramps, irritability, or restlessness.
After cholera colonizes in the small intestine, the systems quickly affect the body. The severe dehydration caused can result in kidney failure. If it is continued to be left untreated, after a few hours it can result in shock, coma, and even death.
Historically, the treatment of cholera has evolved over time as our understanding of the disease has improved. In the first cholera epidemic of 1817 to 1823, no treatment was available. Individuals with cholera experienced a quick, agonizing death. Since there was not a concrete medical understanding of cholera at the time, treatment was based on alleviating symptoms of pain rather than curing the disease.
In fact, opium was sometimes used to alleviate pain and diarrhea associated with cholera. It could help in managing symptoms but did not target the underlying cause of the disease. However, this treatment actually has negative effects on the body, as the drug inhibits muscle movement in the bowels, leading to constipation, and has many other negative side effects.
According to William G. Bursley, another treatment for cholera in this first pandemic was confining the victim to bed and taking some of the warm, mild, aromatic drink, such as spearmint, chamomile, or warm camphor julep. Once the individual has commenced to perspire, calomel, camphor, magnesium, and pure castor oil was administered. However, it is super important to note that castor oil has super strong laxative properties and can cause gastrointestinal irritation and diarrhea when consumed in large quantities.
It was also recommended that the patient endures bloodletting, a treatment in which there is an intentional withdrawal of blood from a person's body, typically by using leeches or making incisions in the skin. However, when losing large amounts of blood, individuals grow weak and experience a quicker death.
In The second cholera pandemic of 1826 to 1832, boards of health became important aspects of local communities. These boards assured that those with cholera were in strict quarantines and that local facilities were sanitary, or at least sanitary by the 1830s definition. The quote from Charles Broadhead, an 1800s author, describes the medical therapies, which included putting the feet and legs in water as warm as could be borne, with the addition of mustard and common salt to the water. Open a vein in the arm and bleed from 5 to 16 to 20 ounces. Apply a large mustard cataplasm over the stomach and give calomel, opium, and camphor every half hour. If the patient continues to deteriorate, and there was any reason to think he would not, sulfuric in either small doses should be given. At the same time, an enema of a pint of chicken tea with a tablespoonful of salt should be thrown into the bowels.
This treatment has so many negative effects. It is hard to list, but most importantly, sulfuric acid, H2SO4, is an extremely harmful substance, destructive to the skin, eyes, teeth, and lungs. Severe exposure can result in death.
During this stage, the most common and considered conservative therapies always included some combination of calomel, opium, and bleedings. The more radical treatments included tobacco, smoke enemas, in which a boiling tobacco-infused water was administered into the intestines, electric shock therapy, and beeswax/oilcloth plugs forced into the victim's rectum to stop the diarrhea. These were all among the distressing encounters.
All the treatments listed above have extremely negative effects on the human body. In total, the interestingly strange historical treatments for cholera hype the growth of the medical field.
In the third cholera pandemic of 1849, through the efforts of London scientist John Snow, germ theory was understood due to his observations of cholera victims and their water sources. He is an extremely important historical figure that contributed to the understanding of cholera today.
Now treatments for patients with cholera can reduce mortality rates from above 50% to less than 1%.
Now, treatment focuses on rehydration. Oral rehydration therapy, or ORT, involves the administration of mixtures of oral rehydration salts, ORS, and clean water to replace the fluids and electrolytes lost through diarrhea and vomiting.
We decided basically to go from house to house and teach one woman in every household how to make oral rehydration fluid at home.
Brack trained an army of instructors. Teaching the formula took minutes. Half a liter of water, 1 pinch of salt, and a fistful of sugar. Teaching 13 million women took about 10 years. But child mortality rates were cut in half.
When oral rehydration is not an option, intravenous fluid replacement is necessary to ensure patient safety. This involves the administration of fluids and electrolytes directly into the bloodstream. Whether oral or intravenous, hydration is the primary treatment for symptoms of cholera and significantly decreased mortality rates.
In conjunction with hydration treatments with antibiotics are recommended for severely ill patients. Antibiotics are administered as soon as the patient is healthy enough to tolerate oral medication. In many countries, doxycycline is recommended as the first treatment for adults, including pregnant women and children. If resistance to doxycycline is documented, azithromycin and ciprofloxacin are alternative options. Zinc supplementation is another modern ailment for cholera. It is shown to help reduce the duration and severity of diarrhea, promotes immune system function, and aids in recovery, especially for children.
With less radical treatments, the abundance of supportive research, and greater understanding of the human body, modern practices are way more effective and safe than the historical treatments, shifting the focus from solely managing symptoms to treating the underlying causes of cholera has resulted in the greater understanding of the human body.
Cholera research has enhanced surveillance systems and outbreak responses strategies. This includes the development of rapid diagnostic tests for early detection, improved monitoring of cholera strains, and the establishment of networks for sharing different informations and coordinating response efforts during different outbreaks. Cholera research has had a profound impact on public health and our overall understanding of bacterial diseases. It has contributed to the development of life-saving interventions, improved water and sanitation practices, and overall advanced our knowledge of bacterial pathogenesis and immunity. Thank you for listening to today's presentation. Goodbye.
Bye.